Welcome to today's presentation, What School Nurses Need to Know About Emerging Air Pollutants and Their Impact on Student Health. No financial relationships amongst this team related to the content. Here are our learning objectives for today. So my name is Holly Henderson, and I'm our Director of Strategic Education Partnerships at Chemical Insights Research Institute of UL Research Institutes, and we call ourselves CIRI. And I'm pleased to be joined today by my colleague, Dr. Christy Bell Huff, our research manager, and by Clayton Wetzel, who's a school nurse at Waitsfield Elementary in Vermont. Today, we'll walk through four main sections. First, why indoor air quality matters in schools. Next, emerging risks to school indoor air quality. Then solutions for healthy school indoor air quality. And finally, the role of school nurses in implementing solutions. But before we get started, we also wanted to highlight how today's presentation fits into NASA's School Nursing Practice Framework. So today's conversation will focus mainly on the quality improvement, or the orange or kind of peach section, and the community public health green section. We know that school nurses can provide information, but to get things done, you need the buy-in of the facility staff. So we see this as an opportunity for nurses to serve as leaders in their schools. And our goal today is to empower you as school nurses to lead on the issue of healthy air quality in our schools. So let's start with our first section, why indoor air quality matters in schools. So we know that our school buildings are important. Approximately 20% of people in America spend their days in school buildings. And unfortunately, we know that many school buildings, in fact, half of them, have issues with poor indoor air quality. Recently, a survey found that more than half of public school districts needed to update or replace multiple building systems or features in their schools. Hopefully, some of that has started to change, but we know there's a lot of work to do. But at the same time, we know that ventilation is critically important in schools. For example, a study found that students in classrooms with higher outdoor air ventilation rates scored 14 to 15% higher on standardized tests than children in classrooms with lower outdoor air ventilation rates. But what if the indoor air quality is poor? We know that in schools, poor indoor air quality leads to increased absenteeism, that's for both the students and the staff, increased respiratory ailments, lower productivity, lower student motivation, lower test scores, and slower learning, plus higher medical costs. Let's look at the health effects specifically. The impact of poor indoor air quality depends on the specific pollutant and the amount of exposure. But generally speaking, short-term effects include irritation of the eyes, nose, and throat, headaches, dizziness, and fatigue, respiratory diseases such as asthma or COVID-19, and we know that respiratory diseases are particularly an issue seen in children. Now, long-term effects can include both heart disease and cancer. So who is impacted the most by poor indoor air quality? Our sensitive populations include children, especially those with asthma, aging adults, or those that are immunocompromised, those that might have weakened immune systems via drug therapies, etc. The chronically ill, especially those suffering from cardiovascular and respiratory issues, pregnant women, and disadvantaged populations. We know that as school nurses, children are of particular importance. Children are sensitive to air pollution because they engage in more vigorous activity, as we see here in this picture. They inhale more air per pound of body weight, and they have developing organs and immature immune response. Some additional factors that make school indoor air quality especially important to children include the many hours that they spend in school facilities, their inability to detect airborne hazards, and their positioning. They're lower to the ground, so that might be closer to dust. So let's take a moment to focus specifically on children with asthma. We know it's quite a large group. Today, over 5 million children have asthma. That's 1 in 13. It's the leading chronic disease in children and the leading cause of school absenteeism and hospitalization. We know that children who are exposed to high levels of VOCs or volatile organic compounds are 4 times more likely to develop asthma compared to adults. We also wanted to highlight that there's a growing number of studies that have shown that human health vulnerability to poor air quality can be influenced by several factors, such as those related to location, socioeconomic status, race, ethnicity, etc. Now that we understand who is most impacted by poor indoor air quality, let's briefly look at how exposure to pollutants occurs. Humans are exposed to pollutants in a variety of ways: inhalation, ingestion, and dermal transfer. We're going to come back and speak about inhalation just a little bit more in more detail in just a moment. But let's go through each one of these. So for inhalation, people may breathe in hazardous particles and chemicals. For ingestion, people may swallow subtle dust, typically from a hand-to-mouth behavior that you more often see in children. They may also drink contaminated potable water. Dermal transfer. People may come in contact with subtle dust. They may also shower or wash their hands with contaminated potable water. So let's do that deeper dive now on inhalation. I think this is fascinating. We're talking about air quality so much today because it's such a significant exposure route with inhalation. Humans breathe more than 15,000 liters of air every single day, consuming approximately 4 times more air than food and liquid together. As a result, we receive about 75% of our environmental pollution from the air that we breathe. We spend about 90% of our time indoors, where pollutant levels can routinely be 2 to 10 times higher than the surrounding outdoor air. And at certain times during and after new construction or during renovation, indoor air pollutant levels can be hundreds of times higher than outdoors. So Clayton, what is happening in your school related to indoor air quality post-COVID?
Thanks, Holly. That's a really great question. So after COVID, the ESSER and FEMA fund granting allowed us to do changes to our HVAC. So we were able to increase our air filtration to MERV 13, which is a minimum efficiency reporting value, or removing 75% of the airborne virus. And we have a schedule to maintain the filters and change them based on the manufacturer's recommendation. The increased minimum classroom air changes were made to 6 per hour and even higher in our music room. I think that was around 10 air exchanges per hour. We minimized the air recirculation in the room, so we wanted to have air coming in and going out of all of our rooms. We supplemented all of our occupied spaces with appropriately sized HEPA portable clean air filters. And during the warmer weather, we are now running our bathroom exhaust fans 24 hours a day.
That's really interesting. Thank you so much, Clayton. So Christy, can you introduce us to Section 2 and tell us more about emerging risks in schools?
Sure. So thanks, Holly. Let's turn now to what threatens indoor air quality in our schools. But before we get into the emerging risks, let's do a quick level set on some of the basics. So there are many sources of pollutants in schools, and these can include things like common products like flooring, furniture, and personal care products. It could include activities that are taking place in and around the schools, like vehicles that are idling or cleaning and painting, or even art or science projects in the classrooms. And of course, people themselves can bring in viruses. They can expel chemicals through their breathing. Our classroom pets can certainly bring in allergens as well. So what's coming from these sources specifically? Well, there are several different types of pollutants, and these include volatile organic compounds, or VOCs. So that would be something like formaldehyde. There are semi-volatile organic compounds, or SVOCs. These could be things like the flame retardants that are added to our furnishings. Particles, so coarse and fine particulate matter, also represent a type of pollutant. We've got allergens and biological pollutants, carbon monoxide, and ozone. The bottom line is we are collectively exposed to a complex mixture of pollutants. So now let's take a look at how some of these emerging sources could contribute to that mix. We're going to discuss several emerging threats. These will include emissions from new learning technologies like 3D printers. We're going to look at emissions from electronic nicotine delivery systems or vaping. We're going to look at increased pollutant exposure from climate and weather. And these are going to include things like excessive moisture or extreme heat or wildfires. And then we'll look at changes in cleaning practices that probably came about to mitigate aerosol transmission of COVID-19, but now may be impacting our indoor air quality negatively. So let's start with 3D printing. Now, I don't think any of us would argue that 3D printing has opened up tremendous teaching and learning opportunities. They really bring a creative and hands-on approach to the classroom. But a few years ago, we started to hear from parents and teachers who were noticing adverse reactions from people that were around 3D printers. And so we worked with Georgia Tech to conduct research on the impact of 3D printing on indoor air quality. And in our research, what we found was that during operation, 3D printers generate a complex mixture of both airborne particles and volatile organic compounds, or VOCs. We have in fact found well over 200 different VOCs associated with 3D printers, and these have included things like styrene and caprolactam and formaldehyde. Many of the VOCs that we found are irritants and odorants, but some of them are carcinogens. Now, most of the emissions from the 3D printers are very small particles and volatile organic compounds, as I mentioned. But these particles, they're referred to as ultrafine particles because they are so small. And in fact, they're so small that they can act as a gas. They can get deep inside of our lungs and they can even enter our bloodstream. So really, in light of these findings, we developed a standard. It's called the ANSI-CAN UL 2904 standard, and it was developed to certify printers that have been proven to be low emitting, so printers that have reduced emissions. So there are now printers available in the market that have met this standard, so they are verified to be low emitting. So if you're at all involved in the purchasing of 3D printers at your school, this is something you might want to take into account. But back to these health impacts. Exposure to these pollutants can certainly be a health hazard, and especially to those who are standing near the printer in a space where maybe there's minimal or little ventilation. So Clayton, what are you as school nurses seeing related to 3D printing?
A lot of what you talked about are things that we're thinking about as nurses as their printers come into our schools. So one, they're increasingly being added to the schools and into multiple locations within the schools. And often there's no interaction with the school nurse or the health office where the 3D printers are being placed. And since it's such a novelty item around watching the printer, how it's working, especially on the young students, there's definitely an increased exposure risk for respiratory issues. And the nurses have no way of knowing if those that are selecting and setting up the printers and the filaments that go into them are considering the potential exposure risks or health hazards of the emissions and the best practices for placement and for room setup. So a couple of takeaways for the nurses is make sure you communicate with the potential health impacts and the best practices to those making purchasing and the set up the decisions and facility staff maintaining the area. Being aware of the purchases will allow the nurses to keep an eye out for any potential health issues related to them, specifically about respiratory concerns. And the bottom line is, since there are potential health risks, the school nurse needs to be involved in the acquisition process to ensure that all hazards have been considered prior to the purchase and placement into the classrooms. And just as an example, we do a project every year, the different things that kids can participate in. And one of them was for folks to be able to actually create a project with a 3D printer. And I spoke with the volunteers that were coming in about the printer itself, and they actually had plexiglass that surrounded that printer so that the students couldn't see over the printer. They could only look at the printer. So there was less possible exposure from that standpoint for them to breathe in any of the material.
That's great. That's super helpful. I think it's great to have your perspective as a practicing nurse here. So I appreciate that. So now let's turn to the next risk, which we're going to cover, which is vaping or electronic nicotine delivery systems. And really, due to a lack of research in the marketplace, we partnered with Georgia State University with their School of Public Health, and we looked at the harmful effects of vapes and e-cigarettes. And what we did was we characterized the airborne particulate aerosols and the volatile organic compounds that were released during vaping. And that helped us determine the exposure levels and the toxicity of those exposures for the users and the bystanders. We have some unique technologies at our laboratories. We have exposure chambers that allow us to do real-time exposure studies. So we can, in real time, measure the emissions from these devices. We can then characterize the aerosols chemically, and then we can measure the biological activity and the genotoxicity of these aerosols as they influence real cells. So that really helps us look at the potential health impacts for these emissions. So, and in our work and the work of others, we've actually found that, again, there is a complex mixture of chemicals in these ENDS emissions, and we've identified chemicals of concern. There are industrial chemicals, there are pesticides, and even some of the flavorings that are used are linked to possible toxic effects and respiratory irritation. And so the ENDS aerosols that the users are breathing in and that the non-users are being exposed to secondhand, those can also contain metal contaminants. And typically those come from the heating elements of the devices, but we can see metallic contaminants in the emissions. We can see numerous volatile organic compounds, and again, those ultrafine particles. And we really do need to think about these results. We want to think in terms of what they mean to those being exposed secondhand. Recent studies have shown that 70% of inhaled ENDS aerosols are subsequently exhaled, and that's going to contribute to secondhand exposure. And that's a significant concern in schools. Secondhand streams can certainly present a risk to children and young people and those who are also susceptible to adverse health effects from being exposed. So Clayton, as a school nurse, what are you seeing related to vaping?
So Christy, vaping is a very big issue in Vermont. So I have some statistics. As of 2021, 16% of Vermont high school students said they used e-cigarettes at least once in the past 30 days. And of those students, 30% said they did so daily. And students who smoke cigarettes tried flavored tobaccos before the age of 13. So we're finding the kids are very adaptable, and they're able to figure out ways to get around any controls that are put into place to help eliminate these products from being used in schools. And it's not just happening in the bathrooms, even with the doors removed and vape alarms. They're doing it in the hallways and on buses. So one effective strategy is education and leveraging peer pressure in a good way. So having students basically convince other students to stop from a health standpoint. The other possible risk is there can be THC in these ENDS, and the children inhale this, it creates a risk for their young, undeveloped minds. This is especially true in states where CBD is legal, so that's just another concerning side effect of these products being available. So as an example, a couple of years ago, we had elementary, middle, and high school students riding the buses at the same time, and this exposed those younger kids to these products. In our district, we changed the timing of the elementary schools, and we actually had the middle and high schools going to school later. They started an hour later, so the busing schedules changed. And because of this, it was able to eliminate that contact with the much younger students for them at exposure standpoint. So that was a positive effect of, and it's actually better from a sleep standpoint for the older kids. They need a little more sleep for going to school. And then I just want to mention that a recent update in Vermont's laws, they're helping sort of. The House and Senate passed legislation to ban flavors on the 15th of March of this year. The governor actually vetoed that in April. And he said that the law was hypocritical because Vermont allows the sale of flavored alcohol and cannabis products. And my opinion would be it also is a cause of a loss of tax revenue, since tobacco product substitutes are taxed at 92% of their wholesale value. And it was estimated that the loss would be between $7 and $14 million annually.
Wow, well, thank you, Clayton. That's good insight. So let's turn now to our next emerging risk, which is related to climate and weather. And these can include hazards like extreme heat and excessive moisture and even wildfires. Now, we're used to thinking about the impact that climate and weather have on the outside of a building. However, what happens on the outside, excuse me, also impacts the inside. So extreme weather conditions can lead to chemicals in the air, in the indoor air, mold in the indoor air, more particles in the air, excessive temperatures inside, increased humidity indoors, and even additional dust, allergens, and biological pollutants. And really, depending on how durable the outside of the building is, the inside can experience a range of impacts. So even if the outside doesn't sustain damage, extreme weather can still impact the inside. So even with no exterior damage, building materials can behave differently, and that can result in poor indoor air quality and more exposure for the people who are inside. And we especially start to worry about this when we hear about sustained power outages, because then that takes away our ability to condition the indoor environment. And that's when we start to face some more of these more extreme conditions on the inside. Now, we have looked at the effects of increased moisture and increased temperature in some of our work. And let's start with moisture. So what happens when moisture enters a building? Well, I think the first thing we think about is mold, right? Mold growth can be a significant health issue for building occupants, and even moisture in the building can be a significant issue for schools. So when we think about moisture, probably the first thing we think about is mold, like we said, and there are significant health issues around mold exposure for building occupants. And in particular, there's a strain of mold known as Stachybotrys, and it's a greenish black mold, and it can grow on material with high cellulose content. So that's most of our indoor building materials, our fiberboard, our gypsum board, our paper-based products. So growth on those materials really occurs when there's moisture from any kind of water damage or leaking or condensation, any kind of water infiltration. That constant moisture is required for the growth of that mold. But another impact that arises with when moisture enters the building we may not think about, but that's increased chemical off-gassing. So increased off-gassing occurs when humidity levels rise. So with increased humidity, the ability of certain chemicals to migrate from a material and get into the air, get into the settled dust, well, that is increased. And one chemical that is particularly prone to off-gassing in humid environments is formaldehyde, which is a known carcinogen. So that is certainly something to think about. Now, let's think about extreme heat. What can extreme heat do to the inside of the building? Well, similar to higher humidity, higher temperatures are also associated with higher emissions from building materials. And we at CERI have conducted a pilot research study, and we investigated the effect of temperature on chemical emission from a limited set of conventional building materials. Now, this was a pilot study that additional work is being done as we speak, but our goal was really to identify how chemical emissions from indoor materials might change with increasing indoor temperatures and how that might potentially affect human health. And what we're showing here are the total VOCs released from each material, both at room temperature and then at elevated temperatures. And you can see here the emissions were found to be generally greater at the higher temperatures. And wood flooring in this study showed the greatest emission increase for both the total volatile organic compounds and also total aldehydes. I didn't show that on this graph, but for both of those pollutants, the wood flooring showed the greatest emission increase on increasing temperature. All right, so let's also think about wildfires. Now, of course, fire certainly presents a significant risk to the interior of the building because there's combustion, but the fire is also introducing pollutants. So if the indoor structure and the products that are inside the building catch fire, that can lead to the release of chemicals. And we've conducted open flame testing on a variety of upholstered chairs, and we found that during a fire, more than 500 different volatile organic compounds were identified. Many of these are carcinogens, reproductive and developmental toxins, irritants, and odorants. And in particular, benzene, which is a known carcinogen, was present in very high levels during all of these chair burns. The benzene level reached an estimated level of greater than 25 milligrams per cubic meter. And the reason I'm telling you that is that is significantly higher than the allowable occupational exposure limit. So certainly something we want to be thinking about. And then in addition to just the pollutants in the air, cross-contamination can then occur. These contaminants can end up in our settled dust. They can end up in our water supplies. They can get into our ecosystems. So Clayton, let's turn to you again. As far as climate and weather, what kind of impacts are you seeing?
So Christy, in a word, seasonal allergies. Now I realize that's more than one word, but that is probably the biggest impact that we're seeing in the Northeast, probably and likely across the country. So there was a research article published in February of 2021 in the Proceedings of the National Academy of Science. And the data indicated, one, that spring was starting earlier and there were longer periods of freeze-free days. This allowed plants to have more time to flower and release allergy-inducing pollen. And in fact, the North American pollen seasons became longer by 20 days on average, and more intense, 21% increase in concentration from 1990 to 2018. And the higher levels of the CO2 in the air also boost pollen production in plants, causing increases in seasonal allergies. ClimateCentral.org research shows that there is an increased instances of wildfires. The rapidly warming spring temperatures and a shrinking snowpack make for a longer fire season, up to 2 months longer on average across the West. So I would encourage school nurses to check out the Nursing Collaborative on Climate Change and Health. National Association of School Nurses is a member of this organization, and there will be some upcoming environmental learning opportunities from the National Association of School Nurses in the coming months related to climate change and health and the impacts from the environment.
Okay, thank you. All right, so the last emerging risk that we wanted to discuss really relates to changes in cleaning practices, and they probably came about as a result of COVID-19, but now they may be impacting our indoor air. Now, because of COVID-19, we do know that schools updated and increased their cleaning and disinfection practices, and certainly proper disinfection of those high-touch surfaces, that plays an important role in preventing virus transmission, including COVID-19, but it can have unintended consequences and broader health impacts by degrading our indoor air quality. Many of these disinfectants, they contain VOCs, and VOCs by definition, they evaporate into the air. So the alcohols, the phenols, and the formaldehydes in these products, they can create short-term health effects, including eye, ear, nose, and throat irritation, headaches, and nausea. But chronic or long-term exposure could lead to liver, kidney, and central nervous system damage. So what should we do? Like, how should we reduce aerosol transmission? Well, a better strategy is to dilute the pollutants, and that's usually done through ventilation. So disinfection is a one-time process, while dilution through ventilation, that's a continuous and ongoing process, and it doesn't introduce any additional pollutants into the air. In fact, ventilation will dilute all pollutants that are in the air. So Clayton, I know as a school nurse, you're probably faced with a lot of choices when it comes to cleaning practices, and there are lots of marketing claims out there, things saying they're all natural and non-toxic, and we don't know if that's all necessarily verified. But what are you seeing over the last couple of years related to cleaning practices?
Well, Chrissy, the most interesting part was when COVID first happened is the schools, the maintenance folks, our administration were bombarded with, this is the best product, get this one, it's going to be really great for everybody. And so what we need to do is ignore the hype and or the sales pitch from our vendors and the manufacturers, and we need to look at the actual products themselves. In fact, the Underwriter Laboratories created a white paper in 2013, and it was entitled, You Should Be Aware of Greenwashing Labels. And here are a couple of examples. So the hidden trade-off. This is listing one or two products' attributes, positive attributes, while ignoring all the hazards that are also involved with that product. And the second is absence of proof. So it can't be substantiated of how well the product actually works because the data is not easily accessible. So the nurses need to assist or conduct a review regarding the evidence and the science behind any of those results. And if it's possible to find third-party laboratory testing and the results of those tests for that shows the efficacy of those products.
Mhm.
And you just said this a second ago, but more is not better. So you have to use the products as they're intended and recommended by the manufacturer. So if you have to dilute 1 ounce in a gallon or 10 ounces in a gallon, so you have two different levels of disinfectant, you want to follow those instructions specifically.
Mhm.
So when COVID first started, everyone in the country was scrambling to figure out what the best products were and how we were going to purchase them and use them because there wasn't a lot of availability. So we, like everyone else, bought a lot of equipment, including aerosolizing equipment, which increased respiratory hazards. And before COVID, we were using 8 or 9 different products for cleaning, disinfecting, and or sanitizing with varying degrees of hazardous substances. So what it allowed us to do once we started really looking into this is we chose 1 or 2 products that work for our cleaning needs that were the safest and eliminate all of the other ones, using them up, not throwing them away, but using them up and then going to just a minimal amount of products that we had that would possibly be an environmental hazard.
Great, thank you. So now I'm going to turn it over to Holly to take us through section 3.
I did want to pause for a second, you guys, because in what I so appreciated Clayton doing that research on that paper that UL wrote, but I'm a little bit worried about us saying Underwriters Laboratories. The reason I'm saying this, Clayton, is our organization pretty recently reorganized. And by saying parent company, I don't know if that's accurate. So I don't know,
Right.
Michelle, if that's one of those things you can just like take it
Yeah.
out. Or if
Yeah,
we should we re-record it?
Yeah, no, I can definitely take out that that part because then again, I'm gonna be separating the video, which is the slides,
Mhm.
the audio. So
Okay.
that's an easy fix.
Okay.
Okay.
Cool. Okay.
All right,
Cool.
great. No, and thank you for telling me that. I used those words, and I probably said it differently the last time too. So I don't even know if I said parent company last time, but just the group that you work with. So it's okay. Yep, that's great. I
Okay.
understand.
No worries. And then also, Michelle, it's okay if we go on and off mute and on and off video while the other people are talking, right?
Yeah, that's fine. And I'll definitely, take care of it. I mean, some people are gonna have to go, right, while I, make some edits. Also for the graphs and whatnot, I know that Christy showed, like, right, the amounts of, chemicals like in I guess in flooring it was. So whatever needs to be highlighted, I will definitely have, some sort of action or circle or a square,
Oh,
something
nice.
highlights, right? The, whatever's being highlighted in the graph.
Yeah,
Sorry
that's
for the
nice.
redundant.
That'll be good for the nurses. That'll be really
Yeah.
helpful.
Just
That's
give me
awesome.
this week.
Yes.
Oh,
Yes,
yeah.
that's awesome.
All right, thank you.
Well,
So,
Holly,
what about-
since we're going to be bouncing back and forth here for a minute, I'm just going to stay on camera till like you're done with me and then I'll go off
Okay.
camera.
Yeah, another
Okay.
thing that I can do, I mean, if it's okay, I can take you guys off all of the camera and just zoom on the presentation and just focus on that too,
Yeah.
if that's
Okay.
okay.
Yeah,
It's
that's good.
fine. I mean, like it's editing, this is magic. So we can do anything. This is
Okay,
the hard part.
Awesome.
That's what I was hoping. Yeah. Okay.
This is magic.
Like magic.
Okay, I will shut up and let's go.
Okay. So thank you so much, Christy and Clayton, for helping us understand the emerging risks in schools. Now that we understand the threats to the air quality in our schools, let's talk about what we can do about them with solutions for healthy school indoor air quality. The main strategies for managing indoor air quality are in this wheel. We're going to start at the 12 o'clock position. So source control, cleaning effectiveness, ventilation and filtration, moisture and temperature control, as well as occupant education. So no one of these strategies can remove all of the pollutants, but the best approach combines all 5. So source control is our #1 strategy. And by that, we mean If you use healthy materials so that you don't bring pollutants into the space to begin with, it's much more effective than getting rid of the pollutants after the fact. So specific approaches for source control include the following. Specify or buy certified or verified low emission and specific chemical-free products for anything that you bring into the space. Air products out before use. And this is one of my favorite solutions for source control. And what we mean by air products out is, let's say you were going to buy new furniture for your care room where you care for your students. You could purchase that at the beginning of the summer and unwrap it and allow it to off gas in the space during the summertime when the students weren't there. And then when they came back in the fall, there would be less emissions or less impact on the air quality for them. Also, you could require your vendors and suppliers to do the same thing. They could also bring in low emission and chemical-free products and air products out before installation. Always use products as recommended and dispose of them safely. So next, I'd like to turn this over to Christy to provide us with a school case study specific to source control.
Right, so let's look at an example of the impact that source control can have. So we conducted a study of airborne VOCs at a public middle school in Savannah, Georgia, and we looked at the air quality before and after painting. And the study was actually done because of complaints that were happening in the school district. And so we know that schools tend to use paint often, and sometimes they use paint instead of cleaning. So they sometimes use paint to cover things up, right? So some of these schools had started to have issues, and they were having odor and occupant complaints. And we actually showed that by selectively using low emitting paints, you can mitigate the problem. And what we found was that the low emitting paint made a big difference. So what we found was that the low emitting paint made a big difference. There was a 90% reduction in total VOCs within 24 hours after the application, and that's compared to a traditional paint. And then all of the VOCs that were associated with the low emitting paint were below the detectable levels within 7 days, whereas the emissions from the traditional paint could still be observed in the air even after 14 days.
Thank you, Christy. So our next strategy is cleaning effectiveness. Our main approach is to use cleaners and disinfectants that are lower in harmful chemicals. So the EPA, or the Environmental Protection Agency, provides an approved disinfectants list. So that would be a great resource. There are also various third-party independent certification programs that certify healthier cleaning materials. We also want to vacuum our floors, our textiles and furniture, all the flat surfaces, not just the floors, with a HEPA vacuum. HEPA is a high efficiency filter. We also want to focus our cleaning and disinfection on the high touch surfaces. Use the cleaners in well-ventilated spaces. You also want to make sure that your school has a routine cleaning program to avoid buildup of subtle dusts and films. Next, I'd like to turn this back to Christy for a school case study on cleaning effectiveness.
Okay, so let's look at another example, and this time the importance of implementing a routine cleaning program. So we conducted a study and we looked at 2 different schools, and we wanted to compare the results of reactive cleaning versus proactive planned cleaning protocols. We compared a school that had proactive cleaning protocols in place, and they were using green cleaning products, and we compared that to one that just cleaned reactively, or when things started to look dirty. And what we found was there was a big difference between the schools. Overall, the school with the proactive green cleaning protocols had lower levels of chemicals, particles, and allergens. And when we looked at what happened after each school was cleaned, the school with the conventional cleaners had significantly more higher levels of total VOCs than the school with the green cleaners. And the chart here shows that, showing the schools 2 hours after the cleaning. We also saw a big difference between the schools when it came to allergens. In the school with the proactive green cleaning protocols, we only found cat and dog allergens, and those could likely be brought in on the clothing of the students and the staff. But the other school had several additional allergens, and these included dust mites, mice, and cockroaches. Now, after we compared the two schools with that study, we put a program in place in the second school to start implementing routine green cleaning. And this had a significant impact on the health outcomes of the school. 2 years later, we did a brief study just to show a snapshot of the changes. And as you can see here, absenteeism, asthma medication, and nurse visits for upper respiratory conditions all were reduced at the second school. Back to you, Holly.
Thank you, Christy. So routine proactive green cleaning is the way to go. Ventilation and filtration is another key strategy. Specific approaches include make sure that your heating, ventilation, and air conditioning or HVAC system is diluting the pollutants and transporting them outside. We want those systems to bring in outdoor air, at least 15 to 20%, assuming outdoor air quality is good, of course. If there's a wildfire going on outside or something where the air quality is poor, you would not want to bring in more outdoor air. So also use the highest rated air filter that the HVAC system will allow. Air filters have a MERV rating that measures how effectively a filter removes particles from the air that passes through it. Make sure that all air is either expelled from the building or filtered before returning it to the supply. Check the ductwork to make sure there are no leaks into the plenum space. And have the HVAC system running 2 hours before and after people are inside the building to flush out the space. This is one of the best things that you can do. And of course, a maintenance policy should have a protocol for routine maintenance and filter replacement on a schedule, as Christy mentioned. There are also some additional air cleaning options available. There are now technologies that integrate air cleaning technologies into HVAC systems. And there are also quite a few standalone air cleaners being used to supplement HVAC systems, especially since a lot of major upgrades and renovations needed often will take a long time. When selecting a standalone air cleaner, there's a couple of things to keep in mind. Units are rated by the Association of Home Appliance Manufacturers based on their clean air delivery rate, or their CADR. A rule of thumb is to select a unit that is rated for at least 2/3 of the room's volume. Additional features to look for in a standalone air cleaner include verified HEPA filtration, activated charcoal filtration, and make sure that the unit does not introduce ozone. Next, if your school cannot afford an air cleaner, please check out our Siri DIY air cleaner instructional video for a low-cost solution. Now, our fourth strategy is moisture and temperature control. Mold can be a big issue for schools. It's connected to ventilation. So if you operate your ventilation properly, keep it maintained, keep humidity within recommended limits, then you shouldn't have a moisture issue unless you have a leak. But many schools do have issues due to deferred maintenance. So it could be an issue to keep an eye on. Specific approaches include maintaining indoor humidity levels between 40 and 60%, maintain a comfortable temperature in a range of 67 to 82 degrees. Use dehumidifiers if necessary. Prevent water intrusion and damage by repairing any chronic water leaks or entry points. And dry wet materials quickly and remove any chronically wet materials. We know in schools a lot of spills can happen with kids, and those need to be cleaned up quickly. Our final strategy is occupant education. This is where school nurses need to work collaboratively with the school administration and especially with the facility management team. Encourage the facility management team to inform teachers and staff about their efforts to keep their spaces safe. Share the facility's efforts at indoor air quality management plan through established communication channels such as newsletters or a signage campaign in the building so that people can see what's being done to keep them safe and understand their role in these efforts. Have the data to back this up and report it in case anyone asks you about it. Teach teachers and staff what they can do to help. Do not bring in their own products such as air fresheners or wear strong perfume. Do not close or block air vents within the space. Prohibit the use of outside cleaners. Encourage teachers to immediately report any indoor air quality issues and maintenance problems occurring in the space, in particular those that are health-related concerns. And finally, train facility staff on the protocols and policies so they can do their part to maintain healthy indoor environments. So we've just gone through a lot of strategies very quickly. So here are some additional resources to help with these strategies. You might want to snap a quick photo of this list. These are some independent third-party resources. Next, I'll turn it over to Clayton for the role of school nurses in these solutions.
Thanks, Holly. That's really great information. Now that we understand the potential solutions, let's focus on the role the school nurses can play. So, checklists. Vermont passed Act 125, the School Environmental Health Act, in 2000, which is also known as the Envision program, with goals to improve school indoor air quality, reduce hazardous exposures, and help schools earn the Envision Certificate of Achievement. The Envision program has a school walkthrough inspection checklist, which includes many sections, including HVAC systems, outdoor pollutant sources, classroom dust cleanliness, just to name a few. So if there's a health issue, you need to start with the symptoms and use the data points in the checklist to help you identify what the root cause of that health issue is. You also need to make sure you identify any regionally specific environmental issues, or you need to drill down a little bit. So if you have a circulating respiratory illness versus seasonal allergies versus wood smoke from heating in Vermont versus an active wildfire, all of those can cause respiratory issues. So you need to know what's happening around the school. And then you need to consider these exposures. You need to consider this exposure risk holistically. So is there a specific paint that presents an exposure risk when wet but not dry? So if that was the case, then you could paint over the summer and the person painting could wear a ventilator while they're painting, but then the paint would have a chance to off gas and dry before any of the students or staff would be exposed to the final product. Tracking systems. So who loves data? I'm one of those people that really loves data. So how can we break down silos and enable effective partnerships between the school health office and the facility staff? How do we collect meaningful data? And how will we present this data and to whom? So we need to set up a system that enables us to respond to the issue. So for example, several years ago, we had a respiratory issue within our school. And I tried to tie this to the school nursing practice framework and broke it down in that process. So assessment, students were coming to the health office for respiratory problems and there wasn't an obvious cause. So diagnosis, we created a template in our electronic health record that tracked the symptoms, the room the student came from, and which hallway that room was located in, either the north, the east 1, or east 2 hallway in the building. After 2 weeks, we compiled the data, and the results indicated the majority of the respiratory illnesses were in 3 classrooms in the north hallway. So then planning, we worked with maintenance and asked them to inspect the ventilation. And this revealed that the ductwork hadn't been cleaned for a very long time, which reduced the air exchange and increased the particulate matter in these rooms. Implementation. We were able to get that section cleaned along with all the other ductwork in the building, and then we added that to a preventive maintenance cleaning schedule. Evaluation. So this process required interaction and collaboration between the school nurse, the facilities manager, and the administration, and also our district facility director. Advocacy. We were able to complete this action due to the health visit documentation and our outcome. So after the cleaning, we collected data for 2 more weeks, and we were able to show a marked decrease in respiratory illnesses after the cleaning was accomplished. So we need to have a basic understanding of the ventilation system, or HVAC, and its effect on our indoor air quality. At a minimum, we need to know where the major components are of that system: air intake, air exhaust, where the ductwork is, and where the filters are located within that system. And from COVID, our school went to MERV 13, which was the highest level our system could take. And that was actually the recommended level. So please keep in mind that older systems may not be capable of a higher MERV rating, but the higher the better. So the higher MERV rating may reduce the capability of the system itself due to the undersized air handlers or the size of the ductwork. Better air quality may be achieved with an appropriately sized in-room HEPA filter. For many air quality concerns, work with local facility staff to set up systems to monitor air quality. If there's an unknown increase in respiratory illness in my district, we have the capability to request air quality monitors, which will monitor CO2 and the air exchanges, to collect information to see what might be causing the increased health concern. In fact, according to an article published on Spaces for Learning on March 19th, an ASHRAE sustainability research project began in February 2024, which provided Forest Hills Elementary School and McClure Junior High School in Western Springs, Illinois, with attuned indoor air quality monitoring systems. So this collaboration between ASHRAE and the Attune and the school district is an example of a partnership that will help with increasing, okay. In fact, according to an article published on Spaces for Learning in March 19th, 2024, an ASHRAE sustainability research project that began in February 2024 provided Forest Hill Elementary School and McClure Junior High School in Western Springs, Illinois, with attuned indoor air quality monitoring systems. This is an ongoing project and an example of how partnerships can work. So understanding the basis of the system may help you identify environmental issues and determine the root cause. So safety data sheets. So what are safety data sheets? And I'll refer to this as an SDS moving forward, but they used to be called material safety data sheets. So these are documents that help identify hazardous materials and provide you full details on what the hazards are, and they are now standardized across the industry. And there are 5 fundamental questions the SDS will answer for you. So what is the product? Section 1, product identification. What are the hazards? Section 2, hazard identification. How do I work safely with this product? Section 7, handling and storage. What do I do in an emergency? Section 4 is first aid. Section 5 is firefighting measures. And Section 6 is accidental release measures. And the 5th one is, what do I do if there's an exposure? And that's covered under Section 8, exposure controls and personal protection. There are 3 sections I typically concentrate on when I'm reviewing any new products coming into the building. And that is Section 2, hazard identification, Section 4, first aid, and Section 8, exposure control and personal protection. So you need to work with your local facility staff to identify and reduce any possible hazards. So from chemicals, this could be chemicals that are used in class experiments like acids that or something that might be flammable or combustible. It could be cleaning products. It could be just paint, caulk, or any other maintenance product. Building materials, this was covered before, but carpet, tiles on the floor, including the adhesive, and new furniture, which have PFAS and VOC implications. And then wet or damp areas, mold or standing water, and other external hazards, like where your trash is located, where your recycling and food waste containers are located. And you have to consider not only the location, but the capacity, any odors, and other things that might be coming from those areas. So enabling effective collaboration. One of the things we learned from the pandemic, before COVID, nurses were typically told what to do by admin. After COVID, admin needed the medical expert to be part of the process. In many cases, this was the first time nurses were invited to the table, or in some cases, the nurses made themselves a place at the table. So now that we're at the table, we need to maintain visibility at the highest levels, so that when decisions are made about the high levels that could impact health, and that we, as the health professionals in the building, are included in all decisions that could impact health. We must be afforded the opportunity to provide input on all medically relevant decisions. For example, I'm a member of the district safety team. This gives me direct access to the building administrators, the facility maintenance manager, and the superintendent. So if there is a health concern in the district, it can be addressed at the highest levels. Now, not everyone has this opportunity, but they should make every effort to join so they can advocate to ameliorate any health concerns. It's always better to prevent an issue by being proactive than being reactive to emerging health concern. And historical examples would be building materials that contain asbestos or PCBs, which we are continually trying to remove from buildings as those issues are found. So now I'd like to revisit the school nursing practice framework. Hopefully throughout this, you've seen a lot of the connections in the 4 practice principles: care coordination, leadership, quality improvement, and community public health throughout this presentation. I would like to emphasize the school nursing practice framework was created to promote school health and academic success through fostering a health and safety school environment. And the tagline on it is supporting students to be healthy, safe, and ready to learn. NASN also provided a companion table on the website that shows how the standards of school nursing practice, the competencies, and the school nursing practice framework work together. The 4th edition of the School Nursing Standards of Practice is the foundational layer of the framework, and the 4 practice principles are an overlapping but integral and unified layer within that framework. So here are 3 examples from what we've been talking about that are covered within the framework itself. So quality improvement. The Standards of Practice Competency 15.4 says, use a systemic, ongoing process to monitor quality of care, implement corrective actions, and implement the outcomes of corrective actions. Community and Public Health, Standard of Practice Competency 18.1, is recognize the environment as a determinant of health that impacts educational, health, and social equity. And Competency 18.2, assess the school and community to identify environmental determinants of health and impact on holistic student health and education. Back to you now, Holly.
Thank you, Clayton. So the first slide we're going to have up, I'll say that again. The first slide we're going to have up, Michelle, I think is the QR code makes the most sense. So I'll say thank you, Clayton, and then I'll do this slide. So, and I'm sure you can just insert that later, I'm hoping. Thank you, Clayton. So before we wrap up, I wanted to point out that Siri has a variety of tools available for you to use as you apply these practices to your everyday work. So please scan this QR code to get direct access to our relevant handouts, videos, and e-learning courses. And as an added bonus, we are pleased to announce that our first e-learning course, The Impact of 3D Printers on Indoor Air Quality and Human Health, is now eligible for nursing continuing education. Credit at, I'm going to do that whole thing over. Okay. Thank you so much, Clayton. So before we wrap up, I wanted to point out that Siri has a variety of tools available for you to use as you apply these practices to your everyday work. Please scan this QR code to get direct access to our relevant handouts, videos, and e-learning courses. And as an added bonus, we are pleased to announce that our first e-learning course, The Impact of 3D Printers on Indoor Air Quality and Human Health, is now eligible for nursing continuing education credit at no cost. Nurses, including APRNs, RNs, and LPNs, can earn 1 CE credit upon completion of this course. We'd love to keep in touch. We would like to begin a school nurses advisory council to hear more from you. So please reach out to us if you're interested in that. You can find us on social media and on our website. We have a monthly newsletter. We'd love for you to join it. So I'd like to thank Christy and Clayton for your valuable insight. And we want to thank all of you audience members and all of you school nurses for spending your time with us today, and hope that this has been really helpful. Thank you.